Hello, everyone. My name is Jason Frutos. I am Policy Officer for the Digital Transformation Cluster at EPHA, the European Public Health Alliance, and I will be moderating this session today. We are all experiencing the rapid digital transformation of all areas of our lives, including healthcare systems. And in this context, we really need to advocate for the digital inclusion of all individuals. The digital determinants of health are wider than one could initially guess, and different communities might have diverse strengths, but also specific needs when it comes to ensuring their access to health. So we're here today to learn more about how the digital transformation of health systems is affecting different groups, the opportunities that come with these changes, but also the risks that exist of exacerbating inequities that are already there. So to shed light on all these matters, we've invited 4 speakers that give voice to 4 commonly underrepresented communities. We have here Camille Gunger, Policy and Movement Support Officer at the European Network of Independent Living, Sabine Springer, Policy Manager at the European Union Agency for Fundamental Rights, Sergio Pérez, Policy Officer at the European Federation of National Organizations Working with the Homeless, and Luke Stevenson, Director of Programs at the European Sex Workers' Rights Alliance. So now, before we start, I would like to share with you a couple of housekeeping messages very quickly. So the session is being recorded and it will be available online a few days after the event through our website. And also, to keep the flow of the conversation, we will only be addressing questions towards the end of the webinar, but you can share your questions already with us throughout the whole session using the Q&A tool. So now, let's get started. I will first like to ask our speakers to tell us a little bit more about themselves, their organizations, and the communities that they represent. So, Camille, would you like to go first?
Yes, thank you. Hello, everyone, and thank you for the invitation. It's really a pleasure to be here, also with this diverse panel, and these different experiences. So I am calling from Athens, today cold and rainy, which is unusual for Athens, but okay. And yeah, my name is Kamil Gungur. I am 35 years old, and I live in Greece. I represent the European Network on Independent Living, which is a European network based in Brussels and represents disabled people and our allies. It's disabled-led organization, so created by disabled people and for the interest of disabled people on matters around independent living, so from personal assistance and the institutionalization to any aspect that is around how disabled people can live with choice and control in our communities equally with others. So it can be, it can go to inclusive education, to how climate change affects disabled people and all this stuff, and to accessibility and all these things. We have members in the whole continent and even beyond. Some of our values are self-representation, self-determination, choice and control, inclusion. Personally, I work as a policy and movement support officer. My portfolio, among other, include the youth, our youth network, which is one of the biggest youth networks of disabled people in Europe. Also, digital aspects. I guess that's one of the reasons I'm also here today. And youth, a lot of youth, climate, and some other policy areas. What else is worth mentioning here? Maybe that I'm also chairing the Greek Independent Living Organization, which is also a member of the European one. And yeah, that I was also connected to the European Disability Forum as the chair of its youth committee at some point. So there is also the experience of the European Disability Forum into this topic as well. So as you see, we will represent the disabled people today. And I hope it's useful. I stop here to give the space to others and happy to continue afterwards. Thank you.
Thank you very much, Camille. I think we can now move to Sabine.
Yes, good afternoon to everybody, and thank you very much for this opportunity to participate in this very interesting webinar. My name is Sabine Springer. I'm a demographer and statistician, and I'm working as a project manager at the European Union Agency for Fundamental Rights, which is based in Vienna. So what we're doing normally legal policy and social research related to fundamental rights. And I had the pleasure over the last 2 years to manage a project on the rights of older persons, and in particular in the area of access to public services in digital societies. So I think I can add some interesting insights to this webinar because, of course, public services also include health services. I'm really interested to hear also from the other participants and looking forward to the discussions.
Thank you, Sabine. So I think we can now move to Sergio. If you want to take the stage now.
Good afternoon, everyone. Thank you so much for the invitation. Yeah, I think it's a very interesting topic and definitely more important since considering the speed of the digital transition. As Jaisalmer said before, my name is Sergio and I work in FEANSA, which is the European Federation of Organizations Working with the Homeless. And this is a very long name, but just to summarize, we are just the umbrella organization representing services working with homeless people at the European level. So we have more than 100 members all across Europe, and they provide several services to people in homelessness. It can be day shelters, night shelters, counseling, etc. But we also have some cities as part of our membership, some research institutions. Yeah, we have a very broad membership, and although the digital transition is not one of our most important topics in terms of policy work, I believe that it will be definitely more relevant in the near future.
Thank you, Sergio. So now we can move to our last speaker of today, who is Luca. Luca, what would you like to share with us?
Thank you very much. Nice to see you all, and it's great to see such a good turnout. I'm Luca Stevenson. I'm the Director of Programs at the European Sex Workers' Rights Alliance. We are the European regional network for sex workers' rights. We have 100 members, 110 members now, organization that provides services and advocate for sex workers' rights in 30 countries in Europe and Central Asia. Similarly to like Camille's organization, we are also self-led, community-led. We very value self-representation and self-organization. We really believe it's an important topic, in particular when it comes to public health. And when it comes to our communities, we support and advocate for the rights of everyone who is providing sexual services in Europe. And often, because of the stigma and criminalization, sex workers face many obstacles to access health services, but also people often have a very narrow idea of who is a sex worker in Europe these days. And sex workers can be of any gender. You have male sex workers, transgender sex workers, non-binary sex workers, you have migrant sex workers, but also when it comes to workplaces, you have many sex workers who work in the streets, of course, but many who work in brothels. Some of them are regulated in certain countries and others are criminalized, but also more and more sex workers are working online. And that's what we're going to talk about today. Thank you.
Thank you very much, Lucas, and thank you to all of you for letting us know a bit better the communities that you are here to represent today. And now we would like to move to the bigger section of this webinar, where we would like to know how the digital transformation is affecting your community specifically. What are the barriers to for them to access health, but also the opportunities that come with these changes. So we can, go back to Camille if you want to start this section.
Yeah, sure. Thank you. So let me start with a small disclaimer, which maybe I could say in the previous session, but okay, that's the same. To say that in our movement and in our advocacy, we make a clear distinction when it comes to disability and to health, and to make clear that being disabled doesn't mean automatically being not healthy. That's a very different thing, because many times we see, the approaches in advocacy or in different I don't know, initiatives, when they consider disabled people per se like patients or something like that. And we make clear that, we are disabled means, we face barriers by the society, oppression and discrimination. And this is what causes our disability. Of course, we have our impairments, which might be, health related, or might be just, other body related things. So the fact that I'm sitting on a wheelchair doesn't mean automatically that that I have health issues. I may have, and many disabled have, and that's why it's important for us also to discuss about digital healthcare and access to that. And yeah, let me say that disabled people are a big and not homogeneous group of people. So you can have physically disabled people, and blind, autistic, intellectual disabled, deaf, and that's only, some of the categories of the groups. So, all these groups are differently affected and impacted in many different ways in these discussions. And we often see that disabled people in general are among the most affected and left behind in these kind of discussions. We are often not included or consulted in the design process of things that in theory are designed to us and are supposed to be for us. And this leads, to inaccessibility. We cannot use the services or, benefit from them, or at least not properly. And this leads also to exclusion, which, can often result to violation of our rights. And we hear many stories. Of course, we have here also positive stories when we can really benefit from that. And as we saw also during the COVID-19 pandemic, when, the digital was like very sexy and on the daily agenda for a long time, the only option sometimes, digital inclusion in health systems can be really life-changing, even life-saving for many. And for those people that it might otherwise, they might otherwise face barriers in accessing services like disabled people. So technology and innovation nowadays change our lives completely. We use, applications and stuff, and can learn better what to do and how to proceed with our health and with our lives. But in order to do it properly and in order to have really inclusive digital healthcare systems, we need to ensure that the systems are not have the system has the so-called 3 A's, so that the systems are available, so the people who need it can access them. And we know that many times disabled people don't have access to the system, people in rural areas or people, when we take the intersectionality, for example, also of the groups today in the meeting, we have kind of 4 different groups represented in a way. So, sometimes, there are people who have multiple identities, and these people face often more barriers. So we need to make sure that, this helps, these digital tools and services are available to everyone and affordable also. Because, being disabled, it's an expensive hobby. Very often we need to pay much more to have the same services with non-disabled people in order, to access them or to just to have them, from, I don't know, from interpretation to whatever. So we need to make sure that it's also affordable. And finally, of course, the most famous of the three, accessible for all. So that these tools, technologies, systems, whatever, are designed to our needs, and that we can use them actually, because it doesn't matter for me to have, if there exists an application that I could benefit in any way, if I cannot really use it, it doesn't make any sense. And for example, this webinar doesn't have at the moment sign language interpretation. So if a deaf person wanted to follow, it would not follow. Just to give an example also, for healthcare system, if you need to have a meeting with a doctor online, let's say, you want to make sure that you can communicate with the doctor in a way. So things like that. Sometimes information has to be easy to understand for people with intellectual impairments or other, issues. So they can process the information related for their bodies and their heads. So yeah, to close my time, I don't want to abuse the time of others. Just to say that, digital inclusion of healthcare systems is of crucial importance, and research shows that disabled people really benefit from using it on a daily basis. I mean, I myself do. And it shouldn't happen in the expense of physical inclusion. So, because this is something we also see. So we should have access to both, and also have the choice to choose which one we want to access and when. Because sometimes you hear, okay, you can join via Zoom, you don't need to go to the hospital. But I might need to go, I might want to go. But they might say, no, it's not accessible, okay, you join via Zoom. So we might to make sure that all options are equally available and inclusive to everyone, and we should have the choice to select what is better for us and what and when. And finally, and I stop with that, there is also this discussion nowadays also with AI about data collection and whether this data may be discriminating with people, because, for example, AI systems proceed various information automatically based on standards, and disabled people very often don't match the standards, so we may be excluded from services because we don't have, the ideal profile. For example, if you need to apply, to insurance, you might be discriminated and not access it because, the programs will discriminate and say you don't meet the standards of, a program which will have specific, points that you need to fulfill. So this kind of stuff are very important. And I think that's it for now. I spoke a lot. So thank you. And yeah, looking forward to hear the others.
Thank you, Hamil. That was super interesting. And if you have more things to say, we can discuss it later during the time for the questions from the audience. So I think we can now move to Sabine.
Thank you very much. I think that I have a presentation because I have some statistics which it's easier to see on the screen than when I describe them. But I think they will fit quite well what was just said before. So I will share my screen. So I hope you can see it now. Perfect. So I wanted to tell you a little bit about the research I was doing on older persons in digital societies. And we all know that older persons are a very diverse and heterogeneous group. So there are persons with disability included, but there are all education levels. So there is no thing, one thing fits all. But when we look a little bit at the major demographic, social and political developments in the EU lately, we can see that one thing is true for all member states and also the candidate countries. The European population is aging. When we look at Eurostat data from 2020, we can see that 21% of the population is aged 65 or older, and it is projected to be 30% in 2050. Looking at an even slightly older age group, we can see that in the next 30 years, it is supposed to double to 20% will be in 2050 75 years and older. The other major development is the digitalization. So the European Commission has developed the European Union Digital Decade Policy Program to help member states, but also the citizens, to be ready for 2030. And these targets are, for instance, 80% of the 16 to 74 years old should have at least basic digital skills to be able to take part in a digital society. Looking at the statistics at the older age groups, you can see that only at the moment, only 1 out of 4 of the 65 to 74 years old have this level of basic digital skills. I have to add here that this is Eurostat data. There is an indicator which monitors the developments, the digital developments, and the data collection ends with the age of 74. So we nearly know nothing about those who are aged 75 and older. Another target of the digital decade is that by 2030, 100% of key public services should be available online, and 100% e-health records should be available or accessible online. To have an idea how realistic this is, in 2020, only 38% of the 65 to 74 years old have been in contact with public services, and this concludes all public services using the internet in the last 12 months. I wanted to talk also a little bit about the online activities, or better, the activities that people can do online, and especially older persons. When you see on top, there's quite a large percentage of people who use the internet, who have digital skills. But when you look at when they use the internet for seeking health information, for instance, we only have 36% of those aged 65 to 74 who have used the internet for this. And this goes down to accessing personal health records online, only 15%, or other activities like so that you can avoid to go to the hospital or to visit a doctor, this is only 12%. So we still are far away from an e-health system where everybody can easily access services and do what they have to do from home using a mobile device. So we have looked at the aging, we have looked at the laws and at the policies, and in general, we have seen there is a certain protection of people when using the internet or when using the digital services. One problem is that very rarely it is ensured that people have the right to choose, meaning that they are not obliged to use digital tools to use public services, but that they can go through offline channels like telephone services or in person. And this is also especially important for people who are living in rural areas, because it's also a point where you have a contact to a human being, where you talk. It fights against isolation if you can go to a public service and do your things online there. On the other side, it has, of course, really good aspects as well, because if you have problems to go physically somewhere and you have internet access, then you can do it through with your smartphone, for instance. However, I wanted to focus in my presentation on the promising practices we have found. So I used for this the concept of the digital divide, and we call it gray digital divide because we look at it from the perspective of older persons. So the first digital divide, level digital divide, is the access to infrastructure and devices. And here the main issue for older persons is affordability. And we have a very good practice in Slovakia, where senior tablets are distributed to people older than 70. And these tablets are already programmed to provide easy access to the internet, to applications, communication tools, but also health applications. So health diaries, doctor's visits, and potentially also you can connect to the healthcare database. Something which is also interesting is that this is accompanied by a lot of training of older persons, how they should use these tablets. A second level digital divide concerns the internet use. Should perhaps, no, not yet. The internet use and digital skills. And there the main issues are interest and training. And this means that we need digital inclusion measures, digital literacy across the life cycle, targeted offline and digital support service, and especially inclusive and user-centered service design through co-creation, co-design, and participatory design. And there is a good example in the Netherlands where they have made a helpline together with other organizations so that people can go there and ask for help if they do not manage to connect also to these services. Or in some countries, you can use public libraries where there is staff who helps you, first of all, with your device, but also provides you with the skills or training for the skills you will need. And also Greece has a local citizen service center where they either help you to fill out the forms physically, but also they help you to know how to use the system and do it online. The third level digital divide concerns the inequality of outcome, meaning that the same internet access, the same skills, but still older persons very often have less success or less valuable outcome when they use the internet. So we need to empower users. And here is something very, very important, because we have to fight stereotypes, such as that older persons are incapable, technophobic, or unwilling to engage with ICT. And again, here we need these inclusive and user-centered designs through co-creation, co-design, participatory design. In Cyprus, they have developed the digital service factory, or they plan to do it, which will help people, citizens, to access the public services, which will be 100% online, but it will be user-friendly because people of all backgrounds will help to design these services. And finally, I wanted to say our conclusions. And first of all, we need to apply a fundamental rights perspective on aging, but this also applies to other groups where we can use a fundamental rights perspective, because if we use this and a life cycle perspective, we can make sure that there is a legal protection of all groups to have access to digital tools, that their rights are protected in this context. And it would also allow to monitor the developments so that we can address the specific needs and experiences. And it should ensure political participation for all, because, for instance, certain political participation, things like surveys or consultations are moving more and more online. We also have to combat ageism. We have to fight the deficit-oriented picture of older persons. We have to include persons aged 64 and more systematically in all lifelong learning and skills processes, which is not currently the case. We also have, again, to include them in the designing these digital services, but also the relevant support services. There are arbitrary definitions of old and age cutoffs, and often, especially in statistics, when they refer to adults, they only mean 16 to 74 years old. And we have to help older people to overcome stereotypes and to engage with new technologies and to acquire digital skills. And Also, something which I find quite shocking is that people aged 70 years and older are not covered by the monitoring of digital indicators. In other areas of statistics, older persons are from time to time included, but in this particular thing, not, where we really would need to know what is the situation and how we can address their needs. And we have to include older persons and others who are living in residential institutions and in data collection. Thank you very much. I try to stop. As an older person, I always have this problem. These are, I must go back to this thing, which doesn't want to come back. You can read the details in you can read the details in the report. I have to say that digitalization is an issue for many people, because it is not like a generational issue that next generation will be better equipped and will have no problems with digitalization. The developments are so quick, and I'm a concerned person. I'm approaching 60 years. So the developments are so quick that you have to all the time update your skills. And since older persons are very often excluded from lifelong learning, these official channels, there is and there will always be a problem if this is not addressed properly, so that they get the skills which allow them to access e-health records, e-health services, and any other public services which are of importance. Thank you very much.
Thank you very much, Sabine. It was super interesting to learn all the work that you did during this study, and we invite everybody who is interested in the topic to read that report in detail. There is a lot of very useful information there. And I think we're now ready to move to what Sergio wants to share with us today.
Yeah, so thank you so much. I agree, it was a very interesting presentation. So I will probably have a look later after the webinar. So I think it was a very, you underlined like a couple of concepts that I also wanted to share at the start of my presentation before going deep in the main barriers and benefits of digitalization for people in homelessness. It's about this target of the 2030 digital decade, about at least 80% of people with basic digital skills, which like we analyzed like a couple of years before in France and so on. And yeah, at the first sight, it seems reasonable, because now probably the percentage is quite lower, etc. But when you think about it really, I mean, then the question is, what happens to the other 20% that is not included in these policies, in these strategies? Because it creates incentive for member states to work only to achieve the 80%. And then for the rest of the 20%, like, what do we do? I mean, of course, public services and so on, when they are being digitalized, they should offer at least like other options, because in the end, if you do not commit yourself to reach to all the possible audience, de facto, you are excluding people to access public services, which by definition should be accessible to everyone, holding residence in the country, or everyone staying in the country. So that's one of the potential threats that we see for people in homelessness, that if the speed of the digitalization is increasing at this level, maybe in 5-10 years, de facto they won't be able to access basic social services or basic healthcare services, etc. Or at least they won't be able to access it by their own, and they will need at least like another person working with them and counseling them, which limits greatly the autonomy of people. And I think that's also like a common challenge with other people. Yeah, then going to the more to the topic, we see that there are many barriers for people in homelessness, and we also categorize them as Sabine just did, like in a first level, everything concerning to hardware and inputs. So what we could see, the access to a stable internet connection, to charging stations, to a desktop computer. It's things that for us, it's already a given. It's everything that I just said, like it could be accessible. But when you don't have a stable housing situation, or when you are moving between shelters or going rough sleeping and so on, you won't have like a stable or continuous access to charging stations, for example, to charge phone, probably a desktop computer either, unless that you go to specific hours to a specific service. Um, and then apart from these barriers, we also find that there is a second level of barriers, also related to digital skills, because as it happens to the rest of society, not everyone has the same level of skills. It depends on the level of education, the accessibility to have information and communication technologies on a daily basis, etc. And we also find like another barrier in how websites of public services and public administrations are designed. Because many times they are designed mostly for using them with a computer. And when you look at data of the use of digital technologies by people in homelessness, most of them, it's really way more frequent that they use mobile phones or smartphones than computers. So when you don't design your websites so they are accessible for smartphones, for example, they can be exclusionary. Also, other barriers relate to the access to a stable internet connection, like data plans, the affordability, etc. Sometimes people need to rely to public Wi-Fi networks, like in libraries, in public services, in shelters, etc. That, of course, are very limited because public Wi-Fi networks normally they have less capacity than private networks, and they are also limited in terms of hours. Like public libraries close at certain time, and if you don't have like a data plan for later, then you are de facto, maybe you have a smartphone, but you cannot use all the internet possibilities of that. And that's also, it brings me to the topic that people in homelessness, they are not really digital excluded at 100%. When we see data and when we see in practice, like a great number have smartphones, for example, but the problem really relates on all of these barriers that I just mentioned, that they don't have continuous access to charging stations. So maybe they have a phone, but it's without battery. They don't have a stable data plan, and they may lack digital skills, etc. So ultimately, many of these challenges and many of these barriers are related to the fact that they don't have a safe and sustainable housing situation. And this is really the main issue, and this is really the basic human right that people experiencing homelessness are denied. And if we don't tackle both issues, the digital transition and the housing situation at the same time, we will overlook many things. But on the other side, I also wanted to underline some benefits that digitalization could bring for people in homelessness. And that is why it's very relevant to tackle these barriers so people can access all these benefits. And some benefits, we could see it, for example, during the COVID-19 pandemic, when many services closed. People that had access to digital technologies, they could have updated information on which services or centers were opened, what times. They could also have or keep the contact with their social workers or with their nurses or GPs. They could be reminded of appointments, etc. And they could also access, for example, COVID certificates or tests, etc. Which again, if you don't have like enough data connection or data plan for a continuous way, then even if you are like even if you have like a negative test, or if you have a PCR, you don't have the way to prove it in your phone. But also what we identified is that, talking specifically about healthcare, many times people in homelessness are stigmatized or face stigma when they go in person to certain healthcare services, be it for their housing situation, be it because they may lack some residence documents or some like identity cards, etc., etc. So for them to access the mainstream healthcare services, usually it's much more difficult than for the rest of the population. And we identified that actually digitalized options could be a very good way to overcome these barriers that only happen in person. So for example, we have an organization in Bucharest called Casa Ioana that managed to create a digital platform to communicate with the residents of their shelter, to doctors. Also, one organization in Vienna, Neuner House, they provide support to people with migrant backgrounds that do not have a stable access to the healthcare system. And since most of them have a very limited ability to speak German, they run an online service with online lead interpretation. That is an online tool that is very useful and that provides access to healthcare in the end. So we see here like a number of benefits, but again, it's all these barriers that prevent people to enjoy from these benefits.
Thank you very much, Sergio, for highlighting not only the barriers, but also, the positive aspects, and, teach us how we can learn from the, strengths of these communities to make sure that they have access to health and healthcare. And now, if that's okay with all of you, we would like to move to our last speaker of today's webinar, who is Luca. Luca, what would you like to share with us today?
Yes, thank you very much. So I will probably repeat a few points that have been said by other speakers, but I wanted to start actually by the positive. I'm doing this webinar from the offices of Médecins du Monde in Paris, Doctors of the World, where we are working on different projects together. And Médecins du Monde has a very exciting project called Jasmine Project, which is an app and a website that has been designed with sex workers in order to report cases of violence against sex workers. And I want to start with this example, that it is possible to have very good platforms, digital tools that have been designed in partnership with the communities, and that really responds to the needs of the community. And this website and this platform then is used by all the different actors that work with sex workers, and then really able to prevent violence against sex workers, but also offer services to sex workers. So for example, if I'm having a bad client, I can just type, oh, this guy with a scar here, he was threatening, he didn't want to use condoms, be careful, don't speak to this guy. And then other sex workers are warned about this. But then while I'm on the app, I can also be like, oh, and I also need to get HIV test, so I need to get access to PEP because the condom broke. Or this is the closest sex worker-friendly services I can find. So in some way, the digitalization can really have lots of potential benefits for sex workers if the tools are created with the community. So that was the positive. That was fast. Now we can go into the threats and the obstacles, which are many. And I think, as other speakers have said, the issue is that sex workers are not homogeneous communities. Sex workers, one of the main characteristics is that it is a very diverse community. Lots of sex workers are migrants, lots of sex workers belong to the trans community, lots of sex workers are sex workers who use drugs or are single mother, many sex workers have a disability, and all this intersectionality creates like different layers of vulnerabilities. I think when we talk about inclusion of marginalized communities, I think it's important that all of us are speaking from a specific group, but the key issue is that all these health initiatives and the different designs that are created must be created in partnership with all the different groups. It's not good enough to say, oh, we develop an app that is going to be great for these specific communities. An app, if it's going to be public service, it has to be developed with all the communities in mind. And sadly, different communities face different forms of marginalization, discrimination, or criminalization. And that's the case for sex work. What it makes so difficult to work in partnership with sex workers is because in many countries, sex work, whether it's the sex workers, the clients, or the third parties, are directly criminalized. And anyone who can sometimes help sex workers can be criminalized as well. And that is one of the main obstacles to inclusion of sex workers in the design and the implementation, the evaluation of health services. So beyond the direct effect of precarization that like Sergio in particular spoke about, like many sex workers also face precarious housing or are homeless or are migrants and don't have access to digital tools like other citizens. This is a big aspect for us. Another big issue for sex workers is the question of privacy. And that is something that hasn't been, I think, talked too much today. And it's something that even us as sex worker community, we struggle with, because as sex worker is criminalized, as sex worker is stigmatized, there is a huge risk for sex workers to be outed and face the repercussions on it. And I don't know if you are aware, but a few days ago, the European Court of Human Rights announced that Greece had violated the rights of HIV positive sex workers when in 2012, the Greek government and the Greek police arrested sex workers, gave them a forced HIV testing, published their pictures in the paper, sent them to jail, because they were living with HIV and they were contaminating respectable citizens of Greece. And that was like an outrage at the time. And now we are like 2024, 12 years later, several of these women have committed suicide since then because of the impact it had on their family. And now the European Court of Human Rights saying like, yes, Greece violated the right to privacy of sex workers. But when we talk about privacy, it's not just some abstract concept. For some criminalized and stigmatized community, privacy is a question of life or death. And this was exactly the case there. And we see the risk with digitalization when it comes to privacy. When we put our information online to have access to health services, when we are being asked, or do you sell sex, or have you bought sex, etc., it's important in order to understand vectors of contagion, etc. But at the same time, there's always a huge risk for sex workers that this information could be accessible to other more nefarious parties, or that, you know, a currently progressive government could suddenly change and be less progressive now. So there's a lot of question around privacy. And just to give you a very concrete example, as a sex worker myself, when I go to a clinic and I have, you know, COVID, for example, or a sexually transmitted disease, the nurse will say, oh, we can do track and trace. We could inform your clients about the fact that you have an STI or that you had COVID. And that would be great in order to monitor the disease. Except for me as a sex worker, I have to consider like, well, yeah, that would be great for the public health benefits of our society if they were able to contact my clients. But it means for me sharing the number of my clients to the nurses. Like I'm speaking in the UK, I know it's not everywhere, but in the UK with a track and trace, that's what we are asked. And as sex workers, you really take a risk of giving your personal information or the number of your client, etc., to the nurse and to the health personnel. So there's lots of questions that we have to reflect on privacy. And the impact of privacy and the breach of privacy to criminalize communities like sex workers. And again, that can only be done in partnership with sex workers. And I think this is also like where we are a little bit critical of digitalization of health and digitalization in general, because we see governments just rushing towards like artificial intelligence and algorithm, and everybody's like worshiping the altar of, you know, AI, etc. Except that we know that AI is fundamentally racist, sexist, transphobic, and has like a huge negative impact on marginalized communities in like, you know, public services. Like we just had a very interesting discussion at Privacy Camp led by Adri in Brussels last week when we talk about the impact of algorithm and bias on marginalized community, the intrinsic racism and classism of these apps. So I think we really have to question if we need to step down a bit on this digitalization and ensure that there is no negative impact on marginalized communities. And then just to finalize, I think for us, what we really want is that, whether it's like public health bodies, tech companies, and those who design these apps, to really just like slow down and be like, have we really considered the impact of this produce or these products on the communities and marginalized communities? And, it wouldn't be unimaginable to have like a committee that represents, like an intersectionality committee that where the different community members, whether representing the LGBT community, LGBTQI community, homelessness, people with disabilities, sex worker, migrant, etc., come together and review the app and review the tool and review the process to ensure that our needs are really represented there, because this is really not the case in most of the times. But then also evaluate after a while the impact these tools have on our communities. And I feel like for us, as Sergio was also saying, and I think Camille as well, of course, and Sabine, is that discrimination is a very complex phenomenon, but has a huge impact on our communities. And we can't talk about improving access to healthcare for marginalized communities if we don't talk seriously about discrimination. I was mentioning the situation in Greece. People took their lives because they were outed in the media. And this happens constantly. Like sex workers and marginalized communities, discrimination is not just like a vague phenomenon. It can really have a life or death impact on these communities. So I think like really understanding how discrimination function and how to tackle it can only go hand in hand with like decriminalization of sex work as well. As long as sex work is criminalized, as long as sex workers, their clients or third parties are criminalized, it will have a negative impact on public health. And we can digitalize health fully, and we can digitalize society fully. As long as some community members continue to be criminalized, it will continue to have like a negative impact on our communities. Thank you very much.
Thank you very much, Luca, for the passion with which you talk about this topic, your experience and your insights. It was very interesting to me, for sure. And now, before we move to the last section of the webinar, I'd like to invite our audience to start, writing questions if they haven't done so already in the Q&A. And while people are doing that, I would like to ask our speakers to share with us, one key message or one call to action that you'd like to stick with us after this webinar. So what's the one thing that you'd like us to remember after this webinar? And we can go in the same order. So we can start by Camille again.
Yes, thank you. And just to say, it was very interesting to hear also the other speakers and, to see the common aspects, but also, to discover, the different angles. So this kind of webinars are always very useful. And now to go to the message. So very quickly, just to say that more and more disabled people, and I mean other people as well, are turning to the online world in order to be informed, to find also solutions for their health and health issues, to contact doctors, to monitor their health with different devices, wearables, mobile applications, and to manage in general their health routine and whatever. And this transformation brings also numerous technical issues, cultural, ethical, as we saw, for example, with AI, psychological, and social questions. So we need to ensure that these questions will be answered, not only for disabled and other people, but with disabled and other groups. So we will be, part of the discussion and shape together in that case, the digital healthcare systems and, in our healthcare in general. Because e-health, if this term is, let's say, acceptable, e-health could create, an opportunity to reduce health inequalities. And, we want to make sure it happens. Thank you.
Thank you very much. So we can move to Sabine now.
Yeah, thank you very much. It was very interesting to hear the other participants. And I think we could all agree that the digital world could be perfect and very helpful in many cases, but some things have to be assured. It has to be assured that the rights of the people are are not in danger with digitalization, and that there is the access to the tools and also to the skills, but also that there is the freedom of choice which channel to use. So nobody should be obliged to use digitalization if they don't want to. Thank you.
Thank you very much. So we can now hear what Sergio has to say.
Yeah, so just to echo a little bit what you all said, and especially Luca talking about marginalization and discrimination. So if you keep going with the digitalization of healthcare systems without considering the needs and the challenges and the barriers, but also the possibilities of people who are right now socially and digitally excluded, in the end, you will further exclude all these groups.
Thank you very much, Sergio. And then finally, Luca, what would you like to share with us? What's your call to action?
I gave everything earlier. No, I think what already been said, I think it's not just like the groups will be more marginalized. It's not even like a clever public health strategy. If you don't develop public health system where marginalized communities are at the center, then you actually like fail into your like wider public health agenda. And I think there's an interesting conversation to have about what we call like marginalized communities. Like, I'm not an expert on like, people living with disability, Camille is, but like I do believe like 20% of the population live with disability. Like we're not a minority. Like sex workers represent like hundreds of thousands of people, LGBTQI community, homeless people, etc. Like there is a huge proportion of the population that is marginalized in one way or another. And I think not centering the needs of people who are marginalized, it's reproducing the system of inequalities is extremely like detrimental to these people, but to society as a whole. And I think, without wanting to like be too far-fetched, I think it's important to talk about, we should change the design of this app so that it's a bit more inclusive this way or this way. But if we don't rethink and the way our politics work to increase marginalized communities, then we're not going to succeed to have public health for all. Thank you.
So to sum up, we have that we need to make sure that all the questions that are arising during the digital transformation do actually get answered. We need to make sure that we give society the skills to digital tools, access to digital tools, but also a choice to use digital tools or not if they don't wish to. And then finally, I think Sergio and Luca's messages were very interrelated, where you were both highlighting how if we don't include marginalized communities in the decision-making processes, they will be further marginalized. And by doing that, we will not only be failing those communities, but also society as a whole, because this is a public health issue that affects everyone. So thank you very much for your interventions. I think we're now ready to move into our Q&A, and we have already some questions in the chat, so let me share some of them with you. We have a question to all of you from someone who is curious to know, in what capacity do you work with design professionals, so product designers, service designers, user researchers, etc.? Do you have any experience collaborating with, innovators or designers? Camille, you can go ahead.
Yes, thank you. Very quickly, just to say, personally, when it comes to healthcare, I don't really, not that much. But in the disability community worldwide, yeah, this is happening. Sometimes disabled people come together with I don't know, either startups or existing, how to say, existing institutions and programs and this kind of stuff, to develop together what is, most accessible and inclusive strategies and tools and devices. It doesn't happen often and not every day, so we need to make sure, we are more involved. That's why I said the previous message in the previous round. But it happens, and we know we have examples of that. So yeah, I think that's it. Thank you.
Thank you, Camille. Do any of the other speakers, want to jump ahead, have something to say? Not really. So then we can.
I
Oh,
can
Luca,
say
you can go
something.
ahead.
Yes, sorry. Yes, it's about web accessibility. I mean, there has been a lot been done to make websites more accessible to many people. However, this can be strengthened, I think. And we are really trying to work to make our products accessible. But I have to say it is very difficult, and it is time and money consuming. But I think if we manage to get this streamlined, it would be worth it, because it would make the life for so many people so much easier.
Thank you very much, Sabine. And I think Luca also wanted to say something.
I was just gonna say that unfortunately we haven't worked so much with different like tech people, but often at SWA we get emails from like kind of tech bros who are like, hey, we got this great idea of creating a platform for sex workers and their clients. And basically they have an idea and they think they can make money this way. And I think what we would rather is have like people who have like expertise in tech and design and come to us and say, how can we work with you? And I think that also show one aspect of like stigmatization is people who don't know anything about sex work think they already know what's the best for us. It's like, you don't know unless you spoke with us, unless you sat down with us and understood our needs. Don't come up with ideas without having talked to us. And I think that's really a message for like anyone who's involved in like tech, etc. Is like, sit down with us and like, let's think about ideas together rather than you coming up and deciding what's best for us.
Yeah, co-creation was mentioned several times today. Thank you very much. I think we have another question for Sabine in this case. There was someone asking whether you know if there are any actions for adults' healthcare online that are accessible from other countries, because this person from Azerbaijan was saying that online healthcare is not valid in that country. So do you know how to make, a program available to all other countries? Or do you have any experience with something like this?
I mean, the whole aim also of the EU is to make public services also available across countries, so that you can have your e-health record, you can access it from another country. This is still, I'm not a specialist in this and how far they have come, but it is quite tricky. And I am only aware that this is aim for the European Union. So I have unfortunately, no idea about other countries outside the European Union and the candidate countries. Sorry about this.
No, that's perfect. Thank you very much. We have another question. Someone wanted to, know a bit more about this, choice right that was mentioned today a couple of times. This person was saying that actually we are kind of obliged already to use digital tools, and whether you maybe think that there should be an obligation rather for public institutions to effectively help people having digital problems to access online forms and informations. So what do you think? Is there, is the obligation to provide an in-person service, or is the obligation to help individuals to access digital platforms, because somehow that's already kind of an obligation for everyone? Sabine, what do you want to share with us?
Yes, thank you. In fact, this was a little bit the aim of our study, where we were mapping on the national level the legislation. And we found, therefore, that in 9 countries, there were at least policies which emphasized the importance of retaining offline public service options for those who cannot or do not want to use services. So there can be an obligation because there are no other channels maintained, but we are really emphasizing the need that not everybody will be able to use online tools. So I think this is something we really have to fight for.
Thank you. Thank you very much, Sabine. Well, we wait for a few more questions. I do actually have one question for Sergio, if that's okay for you.
just say a quick word about
Oh, yeah, go ahead. Sorry.
But I also feel like it's very important that people have the possibility to refer to health specialists like face to face, because often, with digitalization and post-COVID, etc., like there is a situation where lots of people do not have lots of contact with public institution or access to health generally. And for sex workers in particular, often going to a sex worker friendly, non-stigmatizing nurse or service is actually the first door to talk about other issues. You might go because you need to have condoms, for example. But once you're there getting your condoms, you might start talking about the situation that happened with a client where you face like sexual violence, for example, or exploitation. And this is not going to happen if you have just an online form, etc. So face-to-face meetings with health professionals, like non-judgmental, non-discriminating, is actually really useful to offer like holistic approach to health and not just see health as like a tick box. It's like, okay, you got your medication or you got your condoms or you got your HIV medication. That's not enough. Like lots of sex workers have, and I think like people with homelessness as well, like it's similar. Like it's not just one issue. Health is like so intrinsic with housing, with precarity, with violence, that we need to take all this into consideration.
Thank you very much, Luca. Sergio, my question for you was in relationship to what you mentioned about the pandemic and how you saw that being able to use digital tools to access healthcare somehow increase, engagement with the healthcare system for some people, because they felt less stigmatized by doing so. So my question for you is, what are, the learnings from that experience that you think could improve in-person healthcare? What did you learn from this digital transformation about how to improve actual in-person treatment?
So as I said before, like the benefit in this case was that, well, firstly, since it was a public health emergency, I think that there was like in general a more open mindset, both at the policy level and at the practitioners level, to try reach populations that they usually don't put so much effort to reach, such as people in homelessness in this case. And we saw it, for example, in the when vaccines started being distributed. Suddenly, we saw in many countries that people in homelessness were one of the priority groups, and which is not really the case for many other health policies or health problems. And of course, the fact of having housing or not really was an issue in the in these months. So what we saw, like the main benefit is precisely that. That suddenly just the general public and also the practitioners were more open to engage with a group that is traditionally discriminated. So I think that's something that we should learn from from that experience, and we should apply right now. That's regardless of your housing situation, or you are still a rights holder in terms of health, in terms of housing, in terms of privacy, etc. And that's something that due to stigma and fear and sometimes lack of time and resources from professionals, it's something that's more difficult to realize, but it's possible. It's difficult, but it's possible.
Sorry, thank you. And I think Luca wants to add something to that. Oh, I think you have your hand raised. Okay, so we have a few more questions in the chat now. So we have someone asking, what initiatives did you suggest for working together with companies that develop technological innovation? So do you have any tips here on how we can ensure that the needs of the population are included in the digitalization process? I think this is for all of you. So any, ideas, initiatives on how to better foster these co-creation processes? I don't know who wants to jump in. You can go ahead, Sergio.
I can go ahead. Yeah, so we identified a couple of good practices of collaboration and partnership with private companies, but also not-for-profit organizations that were involved in the technology sector, but not so much in the social care or the area of homelessness. And precisely because of this pandemic, all these different actors joined together just to see what were the needs and how they could help, etc. And just to put a practical example, in England, with the policy of everyone in, it's a policy that was very useful to make everyone in homelessness housed, at least during the pandemic months. So they found the challenge that the Wi-Fi networks of these places were not really prepared to deal with this sudden increase in demand, and also that many of these people that needed to access online services didn't have the digital skills. So Homeless Link partnered with a foundation called Good Things Foundation, I think, just to provide all these extra technical services. And yeah, we have also like a couple of more examples of these partnerships in a policy paper that we produced in 2021. If someone is interested, you can just browse it in our website.
Thank you very much. And I think Camille wants to say something as well.
Yeah, very, very quickly, just to answer the same question, what initiative we suggest. I mean, one idea that comes to mind is that, companies could, or other actors in the field could create something like a working experts group or something like that, work groups, and consult, to have like regularly consulting different, stakeholders, similarly to what the EU does when they want, to propose, I don't know, an initiative, or when we do a project and we have this kind of advisory boards. So to have something like advisory boards on different, stakeholders, to make sure that the initiatives will be, that the stakeholders can contribute and ensure that the initiative of these entities, companies, whatever, will be, accessible, inclusive, and meet, the needs of people who concerned, of people who they are intended to. Something like that. And apart of that, of course, it's up also in one way to our communities to contact, and to be active and to make ourselves visible and make some noise that we are here and we need you to do this accessible and inclusive for us and to make sure you hear us. Something like that. I stop here. Thank you.
Thank you, Camille. And I think Luca wants to share his thoughts as well.
Yes, short point, but I think there is a kind of irony that for sex workers who work online, our main workplace is the digital platform where we sell sexual services. So, if you look at the UK, there is a main platform called Adult Work, which has 80,000, 100,000 sex workers on it. And most sex workers will spend a lot of time there, uploading their picture, contacting their client, responding to them, paying the platform, etc. But because of the criminalization of third parties, these platforms usually are very shady. You don't know who owns them. It's very difficult to communicate with them. And there is no link with public health alliances and organizations there. And I think it's such an hypocrisy, even for male sex workers. If you look at male sex workers in Europe, which are like a significant number of male sex workers, they use the platform like Planet Romeo or Hunks or Grindr, But because of this law on criminalization, technically you're not allowed to advertise on Grindr as a male sex worker. So Grindr will have all this partnership on access to PrEP and chemsex for men who have sex with men. But when it comes to male sex workers, which are more marginalized, suddenly there's nothing to be done because technically it's not legal to advertise sexual services on this platform. So again, because of the criminalization of sex work, because of this hypocrisy that says, oh, it's illegal to sell sex, it's illegal to advertise sexual services, it makes it very difficult to work with what is essentially the workplaces of hundreds of thousands of people all across Europe. So again, for us, we always go back to decriminalization. If it was decriminalized, like it is in Belgium, for example, and there's been good initiative between the main platform for sex workers in Belgium and health services and local community association to provide services, this is the way forward so that our workplaces are also safe.
Thank you very much, Luca. So I think we've run out of time, but we have just one last question in the chat. So if you're okay, we can try to address it quickly. And this is a question for Sabine, but I think it affects all of your communities. It says, it is important to empower people to use digital services, but at the same time, they are also vulnerable as data subjects. Also, Luca mentioned privacy, and I think Sergio as well, when he said that people experiencing homelessness usually don't have access to reliable Wi-Fi networks. So do you have any ideas on measures to protect the right of data protection of the elder users, how to educate them about their right to data protection and privacy effectively? Any insights on the topic?
Yes, thank you. First of all, we have quite good data protection rules in the EU compared to other areas in the world. They are not perfect, that's for sure. I think it is more that there is really, and not only for older persons, there is a lack of knowledge on how to protect your data and your privacy. And this means we need a lot of, and for all people, wherever they come from, whichever education level, we all need training, lifelong training, continuous training to be up to date with the newest threats and how to protect. And of course, we need good apps who can help us to protect ourselves. But I think it's a huge issue.
Thank you very much, Sabine. And I think that's all for today. Thank you very much to all of you who joined us online, those who contributed questions, those who are watching this recording after the event, and especially thanks to all our speakers for sharing their experiences, their insights, and their knowledge with us. Bye-bye, and see you next time.